Hello everyone. In this video, we are going to study the next inquiry of the head and body. From the 10 questions, we have introduced the feeling of or the sensation of coldness and heat. We also have introduced the perspiration and also different kinds of pains in the body. And from here, we actually discussed the fourth question. That's the body, the head and the body. But when you go to the details, you will see that this is quite a wide range from the head, body, chest, abdomen, because the body includes the chest and abdomen. So the topics in this session, there's actually quite a lot. As you can see from the table here, dizziness, tinnitus, deafness. Deafness, it actually also can use the other term, which is loss of hearing. So the deafness doesn't mean have to be deaf. It also can be the reduce of the hearing. Blurred vision, chest tightness, palpitation, distension in the ribs area, stomach stuffiness, abdominal distension, body heaviness, numbness, lassitude. The lassitude also fatigue. So from these a few videos, probably we going to use one or two videos to discuss these categories. The first discomfort we are going to study is dizziness. Dizziness refers to a feeling of spinning when they are stationary or have difficulties in standing or walking. This is actually a very typical and severe condition of dizziness. There are also some other symptoms or feelings that are not that typical, such as sometimes patients will tell you they feel like walking on the wool cotton, or they feel like the floor is soft. So that this kind of feeling is actually very similar if you walk on top of a duvet. So that kind of feeling, the floor is soft. That's also the other way to say that the walking is not stable, because it don't feel firm on the floor. And in order to study the dizziness, to study the pathogenesis, we need to understand why, or in the healthy situation, why we can feel clear in the head, or we don't have dizziness in the head. So in order to perform a physiological function of the head, we need a yang qi to travel to the head. So if we don't have enough yang qi to nourish the head, we will have either headache or dizziness. If we don't have enough yang qi to travel, from here we also got two different causes of this situation. One is the blockage. So any pathogens that block the pathways of the meridian or sanjiao, the pathways of qi and blood movements, which results in the qi and blood could not be transported to the head. It results in the head lack of nourishment. So in this situation, the head will be lack of nourishment, will cause dizziness or headache. The other is the pathogen of fire. So fire, the head is the top part of the body. The fire can move. The characteristics of fire is flaming up. So the fire can travel to the head. The fire can be the excess fire, such as liver fire, or deficiency fire, which is similar to the description here. We says hyperactivities of liver yang. That's the deficiency fire due to liver yin deficiency. So as you can see from here, the discussion of dizziness, you should remember in the previous video when we studied the pain, we also said the blockage and the lack of nourishment. So we have studied the headache. This situation is very similar to headache, dizziness and headache. So in our treatments, we always link together. We're going to figure out either lack of nourishment or the blockage. The blockage can be different pathogens, and lack of nourishment, it can be lack of qi nourishment or blood nourishment. It also can be lack of axons. The axons, that's why the patient will have tinnitus, soreness and weakness in the waist, the knee and joints. So these are, we says that the waist is the mansion of the kidney. Tinnitus, that's the noise in the ear, which orifice is the opening of the kidney, that's the ear, right? So these are the symptoms related to the kidney. That's why we say that the liver or axons deficiency also can cause the dizziness. So in order to understand the dizziness, the symptoms, in order to understand the pathogenesis, in which organs we need to inspect, or we need to analyze the associated symptoms. It may be a red tongue with a yellow coating. It also can be tinnitus or joint pain or weakness in joints or waist. So here the coating is wrong spelling. So these are the common pathogenesis of dizziness. If the dizziness is due to qi and blood deficiency, the patient can present with a pale complexion, fatigue, pale tongue, and weak powers. So the patient, such as when they walk for a short distance and then they feel tired, that can reflect that the qi deficiency. Also, the patient, if they due to the phlegm and dampness, the patient may have a heavy sensation of the head, like being wrapped with a towel. This is a direct translation from 黄帝内经. That's how 黄帝内经describe symptoms in the head. This is just a very visual way to describe the head, the heaviness feeling, the heavy sensation in the head. That's similar, your head being wrapped or you carry a towel on top of your head. The chest tightness, the nausea, vomiting, these are due to the phlegm or dampness invade the digestive system, the spleen and stomach. The white greasy coating, when we study the tongue diagnosis, you will understand that the greasy coating also a sign of the phlegm and dampness. Also, if the dizziness due to stagnant blood due to traumatic injuries, they can present as the stabbing headache. So as you can see here, when we study the pathogenesis, the mechanism of the symptoms, we use the theories that we have studied in the basic theory to understand each single symptoms in the clinic. Why the patient presents with dizziness, and they have chest tightness. And also this patient may have nausea. We try to understand what's the cause of these symptoms, and we try to understand the pathogens or the weakness of the qi or antipathogenic qi. So that's how we begin to analyze the clinical symptoms. We need to find out the main symptoms, which is the chief complaint, and also we're going to study the accompanying symptoms. These different symptoms can help us to analyze the pathogens, such as patient presents with greasy tongue coating. The greasy tongue coating can imply the phlegm and dampness, or the pale tongue, a pale complexion can indicate the qi deficiency. The next symptom we are going to talk about is tinnitus. Tinnitus manifests as an abnormal noise or ringing in the ears. It can be differentiated into deficiency and excess. And these symptoms, this noise can happen in one side of the ear or both sides. And actually from the definition, you can see the description, an abnormal noise. You actually can delete the abnormal because normally we don't have any noise in a ear. So if you are experiencing any kind of a noise in the ears, that's abnormal. Mostly we need to differentiate into excess and deficiency. The different kinds of noise can indicate excess or deficiency, and as well as if the noise can be aggravated by pressing or acute attack, so it happens suddenly. This also can indicate excess situation. The cause or contributing factors may be fire, which fire in the body can cause tinnitus, especially for the liver and gallbladder fire. This is very similar to the dizziness or headache in the upper part of the body that the fire can reduce. So the fire can be excess liver fire or deficiency liver fire. The second is the pathogen, the blockage from the pathogens, such as the phlegm, the qi and blood blockage, or the wind. So no matter what kinds of pathogens, if they block the meridian in the ears, it will cause tinnitus. For deficiency symptoms, the patient may feel the noise is lighter or the noise is not that loud, and by pressing they can feel better. And especially this kind of tinnitus, this kind of a noise happens gradually. Mostly happens in the kidney and the liver deficiency. That's because the ear is the orifice of the kidney. So mostly the kidney and also the liver, because the ear also need the nourishment from the blood, which is stored in the liver. So mostly from the kidney and liver. Deafness. Deafness is actually a direct translation, and the deafness is not only refers to the loss of hearing, as you can see from the definition, is full or partial loss, partial hearing loss, and actually it also includes that's the abnormal hearing, such as if the patient hear double noise or double sounds. For instance, if you speak once and then they can hear twice. So that kind of feeling. You also in this can consider as deafness, or from the treatment you can consider the treatment method according to the deafness. The patient with mild deafness also can be classified as being hard of hearing. This is actually means the loss of hearing, but partial. It also can be differentiated into excess and deficiency symptoms, and these two are actually very similar to the tinnitus. So we're not going to discuss in details. You can watch back to the discussion in the tinnitus. This is very similar. And apart from these two, the deafness, the tinnitus, there's also another feeling that the patient can feel distending feeling in the ears. The distending feeling in the ears, or the blockage of the feeling of blockage in the ears. That's mostly due to the pathogen. So all these different symptoms, they can be differentiated into excess and deficiency. And also from excess deficiency, we need to distinguish the cause, the root cause, either the blockage from the pathogens or from the deficiency, such as the essence deficiency, the qi deficiency, or the blood deficiency due to the kidney or liver. So these are tinnitus and deafness. The next one, blurred vision, cloudy vision, night blindness, and double vision. Blurred vision is a lack of sharpness of vision, resulting in the sensation of spinning like sitting in a boat of vehicles. Alternatively, the affected person may notice floating specks in the front of eyes. Although we are going to talk these different types, different symptoms individually, and these actually, because we need to think about the vision. The vision is related to the eyes, and the eyes are the orifice of the liver. So the vision's problem, we need to think about the liver. That's why, as you can see from the contributing factors, excess or combined deficiency and excess symptom includes hyperactivities of liver yang transforming into wind, and the phlegm dampness affecting the eyes is also related to the liver. Deficiency symptoms is caused by qi, blood, in essence failing to nourish the eyes. So for the vision problem, we are going to focus on the liver, and also we're going to differentiate into excess and deficiency. For excess, as you can see, the more we study, we're going to introduce more and more different symptoms. As for all these symptoms, most of the situation, the first thing we're going to differentiate is to separate them into excess and deficiency. This is also the way of thinking of yin and yang theory. When we want to understand something, when we want to understand one certain object, we always separate them into yin or yang, compared with excess and deficiency. Excess is yang, deficiency is yin. So we also separate them into yin and yang. That's how to understand most of the conditions. And from deficiency, we need to think about the causes of deficiency. What can cause deficiency? The eyes needs to be nourished by the qi and blood, also essence. So the deficiency will limit into qi, blood, and essence, especially from liver. So the liver qi deficiency, the liver blood deficiency, or the liver and kidney essence deficiency. The yin essence refers to the kidney and the liver. So these are blood vision. The cloudy vision is the loss of visual acuity or a dimming of the visual perception. So the explanation is quite similar to the blurred vision, but from here we just give you different definition of these symptoms. So the terms of cloudy vision. What does it mean by cloudy vision? What does it mean by night blindness? Double vision. Night blindness is an inability or reduced ability to see in dim light or darkness, normally sights during a normal sight during the day. So when the light is bright, the patient can have the normal vision. But if the lights become darker, they don't see that clear. So the reduced ability or even lost the vision. Double vision is the simultaneous perception of two images of one single object. So that's actually the double vision in our daily life. Most of the patients they actually describe as blurred vision. Blurred vision is broader than double vision. Double vision refers to such as here one, and then you can see another image at the back. So you see one, and then you see another vision. Most of the condition they will cover some of them, and then they can see two of one single stuff, one single object. Blurred vision is more like you see the object there, but the patient will describe that on the side of the object, they see the blurring. So this is very similar to such as the video. If the resolution is not that good, you will see blurred. The commonly seen in elderly people with chronic diseases. And these three mostly happens in the deficiency situation. So that's why we put them together. And the deficiency mostly because these are related to vision, related to the eyes. So you will relate to the liver, mostly related to the liver and kidney, because what the eyes are the orifice of the liver, but why also related to the kidney? This is because of from the theories, the liver essence and the kidney essence can mutually generate. So that's why they always affect together. Here are some pictures to show you the symptoms, how the patient feel or what the patient see from their eye. So the first one is the blurred vision. Blurred vision, you can see the edge of the object is not sharp. So that's the blurred vision. The second one is the cloudy vision. So they see something similar to covered in front of their eyes. The last picture, this one, is the double vision. So as you can see from the blurred vision and the double vision is different. These two, especially these two. The double vision, the patient can see the edge, the boundary of the objects still sharp, but they see two different objects for one single stuff. This is when you see such as the watch here, it also because it's going to affect the movements as well, especially such as someone they play tennis. When the ball comes to them, they see two balls, one and then the other balls there. And in this situation, the patient will never know which one is the real ball, this one or this one, because the double vision doesn't have to happen on the right side, or doesn't have to happen on the left side. It can happen to any direction. So these are different symptoms from the patient, how the patient feel or what the patient see from their vision. The next symptom is dysphagia. Dysphagia is an inability or difficulty in swallowing, which the patient will describe as becoming stuck or held up before it either passes into the stomach or vomits immediately afterwards. So the patient will vomit or they feel difficult to swallow. So that's what the patient feel. The contributing factors include chi stagnation, phlegm, stagnant blood obstructing the esophagus, or failure of blood fluids to moisten the esophagus. So this problem happens in esophagus. It can be the chi stagnation or blood stasis or phlegm block the esophagus. This also can happen in such as some patients with tumor or cancer in the esophagus, either in the throat or esophagus. So how we understand the tumor or cancer, we're also going to base on the qi and blood circulation, although that's the physical cancer or tumor. In our theories, when we treat the cancer or when we treat the dysphagia, we're also going to focus on the qi, the blood, or other pathogens. Depends on the individuals. Dysphagia also very common to happen in patients suffer from stroke. So after stroke, some patients will have dysphagia, have difficulty in swallowing, and in this situation, from our treatment, we also need to think about the contributing factors. So you don't only base on the symptom. We're going to think about the symptom, what's the pathogenesis, what cause these kinds of symptoms. Then we will treat the treatment will focus on the causes, which are qi stagnation or blood stasis or the phlegm or deficiency of certain organs. Chest tightness. The chest tightness refers to the subjective sensation of stiffness, fullness, and oppression in the chest. So when we see this kind of symptoms, the patient also can describe as oppressed chest. So we need to think about this. The chest is where the lung and the heart stay, and that's why the oppressed chest will relate to the lung and the heart, especially for the qi stagnation, the qi flow. And also because of the liver meridian also distributes to the chest. So this symptom is closely related to the heart, the lung, and the liver. The liver, the patient also may present with the emotion problem, especially for women with emotion problems such as the period the period before the menstruation or in the menopause. The associated symptoms of the heart qi deficiency, palpitation and shortness of breath. The heart pulsations, stabbing pain in the chest, with the phlegm in the lung, cough. So as you can see from here, although the oppressed chest is related to the heart, the lung, or the liver, how do you know which organ is affected? You're going to see from the other symptoms that does the patient feel palpitation or short of breath? Does the patient feel any pains in the chest? Or does the patient cough? If the qi stagnation, the liver qi stagnation, the patient will have distending feeling in the ribs. Frequent sign, the movements or the activity of sign, so they can feel this kinds of feeling and this kinds of movements, activities. They feel better, and this situation, if this happens, it also can indicate that the patient suffers from qi stagnation, because as the patient signs, the qi moves a little bit. That's why they feel better. So in order to differentiate from different organs, we're going to study from the associated symptoms, such as palpitation or cough. So as we study, we're going to introduce some symptoms that specifically related to the one organ, such as palpitation. If the patient feels palpitation, you're going to think about the heart directly, and it can be the combination of the other organs, but the heart must be affected. That's why the patient will have palpitation, such as coughing. It must be the lung. The lung must be affected. The cause, the pathogenesis of the lung, we can see from other symptoms, but for this specific symptom, coughing, can indicate the lung be affected. So from the diagnostic study, we're going to study more and more symptoms, and you need to connect, or you need to link these different symptoms to the different organs or to the dysfunction of qi, essence, and blood, as we studied in the basic theory.